Good evening and welcome. My name is Chris LaFountain, former LNA at the Pines. And here tonight I'm here to talk about hand washing compliance and ways we could raise hand washing compliance. The agenda tonight, we're going to talk about a need. What is the problem? Healthcare associated infections, higher healthcare costs, loss of productivity, and then we're going to talk about a description of what we can do to raise hand washing compliance. And then we're going to talk about a budget and a conclusion, and then we're going to be able to ask questions at the end. Alright, so the first need is the problem, healthcare associated infections. They're some of the worst infections that you can get, and they're very costly to treat because most of them are resistant. And as you go down up the chain, they're more and more expensive. So healthcare associated infections are the most common complication of hospital care, occurring in approximately 1 in 25 patients. The next need, of course, when you get infections, it makes for higher healthcare costs. That only makes sense, when you're sick. It takes treatments and medication, and that costs money. The Duke University Medical Center did a study on the cost of MRSA in people who were hospitalized with it. The average cost was $47,092. So that's a substantial cost. And loss of productivity, absenteeism. Healthcare workers, they're at the most risk, inherently because they deal with a sick public. And what happens is, most of the people that they say, well, I didn't wash my hands because I'm too busy, or they have a big workload. And when this happens and people get sick, people get even a larger workload. People can get burned out. And this is how accidents happen and how compliance lowers. In a Forbes magazine article, figures for the annual costs associated with unscheduled absenteeism costs roughly $3,600 every year for hourly employees, whereas salaried employees are $2,650 each. So that's quite a bit for sick employees. The project description. So what can we do? Well, we can raise hand washing compliance. We want to ensure that every healthcare worker has access to alcohol-based hand rub at the point of patient. And there's no better way to do that than to have it right in your own pocket. It takes much less time than washing your hands, and you're more likely to use it. Training and education of healthcare workers on the most important times in patient care and hand washing, and of course, methods of hand washing, techniques. Monitoring and feedback of compliance. And how we will get to this is every day, charge nurse will fill individual bottles, pump bottles of alcohol, pure alcohol rubs to each person, each staff member. And at the end of the shift, they hand them back in, and the amount used is recorded. And over time, you can get an average. You can see what the normal use is versus what you're using. So if you have an overuse or an underuse, it's a good way to ask questions, see what's going on. And you get a pretty good idea of your usage. To feedback, how we do that is each month the infection control nurse gets a infection rates report, regardless. If we try to do this or not, it's already available. And so we can measure our progress by our infection rates staying the same, are they going up? And of course that happens seasonally anyways, but you'll be able to see a trend. Visual reminders in the workplace is very important. If there's a sign next to the door, every door you go out of that says, "Did you wash your hands?" you're more likely to do it. The residents are also likely to see it, and they're also more likely to wash their hands, and we encourage the staff to give them maybe a dab to rub in their hands. And creation of a culture of attention to patient and healthcare worker safety within the institution. So be aware, and let the residents be aware. It's their health. There's nothing wrong with someone reminding you when you walk out the door. You might have forgot, we're only human. All right. Hand washing compliance. All right, the 5 most important times to wash your hands. Before touching a patient, before clean and aseptic procedures, such as inserting a catheter, after contact with body fluids, after touching a patient, and after touching a patient's surroundings. That's very important. And of course, proper hand washing techniques. We'll have monthly evaluations, and our goal is to drop our our infection rate by 25% in the first year. Budget. This is actually amazingly cheap. So it'll cost $1,200 annually. I mean, just the average stay of one stay from someone that gets MRSA in the hospital is $49,000. But here, for just the individual Purell, it's $1,200 annually. And the information posters, $75, and most of those, we can get right offline. Some of them are scary because microbiology is scary and kind of gross. So it's easy to get something that grabs you, And it's very cheap, so that's very cost effective. But even if it only went 20%, that could save you multiples of what you put into that. All right, and so in the end, this project can lower infection rates, and that's really the main goal. Less infection, it's cost effective, and it's healthier for the residents, the staff, and the visitors. So it's win-win-win all the way around. These are references. Any questions?